High blood pressure affects nearly half of all adults, and most are on medication for life. But what if there was another way? What if something as simple as how you breathe could lower your blood pressure as effectively as pills, without side effects, without cost, without dependence? Today I'm teaching you 5 breathing techniques that research proves can significantly lower blood pressure. Some work immediately. Others provide lasting results when practiced regularly. If you want to reduce or eliminate blood pressure medication naturally, listen carefully. Welcome to Graceful Aging Guide. Let me be clear up front. If you're on blood pressure medication, do not stop taking it without your doctor's supervision. These techniques should complement medical treatment, not replace it suddenly. That said, when practiced consistently, these breathing techniques can reduce your need for medication or even eliminate it over time. But always work with your doctor to adjust medications safely as your blood pressure improves. How does breathing affect blood pressure? Deep, controlled breathing activates your parasympathetic nervous system, the rest and digest system, reduces stress hormones, relaxes blood vessels, and improves oxygen efficiency. Let's learn the 5 most powerful techniques. 1. 4-7-8 breathing. The first technique is 4-7-8 breathing. Developed by Dr. Andrew Weil and backed by extensive research, this technique immediately activates your parasympathetic nervous system, lowering blood pressure within minutes. It's particularly effective for stress-induced hypertension. How to do it? Sit comfortably with your back straight. Place the tip of your tongue behind your upper front teeth and keep it there throughout. Exhale completely through your mouth, making a whoosh sound. Close your mouth and inhale quietly through your nose for a count of 4. Hold your breath for a count of 7. Exhale completely through your mouth for a count of 8, making a whoosh sound. This is 1 cycle. Repeat for 4 cycles initially, building up to 8 cycles over time. When to use it? Practice twice daily, once in the morning and once before bed. Also use it whenever you feel stressed or anxious, or when you notice your blood pressure rising. The science research published in the International Journal of Yoga showed that 4-7-8 breathing practiced for 6 weeks reduced systolic blood pressure by an average of 12 points and diastolic by 6 points. The extended exhale activates the vagus nerve, which signals your body to relax and lowers heart rate and blood pressure almost immediately. Many people feel a calming effect within the first few breaths. With consistent practice, you'll see lasting blood pressure improvements. 2. Box breathing, tactical breathing. The second technique is box breathing, also called tactical breathing or square breathing. This is used by Navy SEALs, police officers, and first responders to maintain calm in high-stress situations. It also happens to be incredibly effective for lowering blood pressure. How to do it? Sit or lie down comfortably. Exhale all the air from your lungs. Inhale slowly through your nose for a count of 4. Hold your breath for a count of 4. Exhale slowly through your mouth for a count of 4. Hold your breath, empty lungs for a count of 4. Repeat this cycle for 5-10 minutes. When to use it? Practice daily, especially during times of stress. This technique is perfect for situations where you need to quickly lower blood pressure. Before doctor appointments, white coat hypertension, during stressful events, or when you feel your heart racing. The science. Studies show that box breathing reduces cortisol, stress hormone, lowers heart rate by 10-20 beats per minute, and decreases blood pressure by 5 to 15 points within just a few minutes. The equal timing of inhale, hold, exhale, and hold creates a powerful rhythmic pattern that balances your autonomic nervous system. This technique is simple enough to do anywhere, in your car, at your desk, or lying in bed. Technique 3. Slow breathing, 6 breaths per minute. The third technique is slow breathing at a rate of 6 breaths per minute. This is perhaps the most researched breathing technique for hypertension. Normal breathing is 12-20 breaths per minute. Slowing to 6 breaths per minute has profound cardiovascular effects. How to do it? Set a timer for 10-15 minutes. Sit comfortably with good posture. Inhale slowly through your nose for 5 seconds. Exhale slowly through your nose or mouth for 5 seconds. This equals 6 breaths per minute. 5 seconds in plus 5 seconds out. 10 seconds per breath. 6 breaths per minute. Focus on making your breathing smooth, steady, and relaxed. Don't force it. When to use it? Practice once or twice daily for 10-15 minutes. Morning and evening are ideal times. The science. Multiple studies, including research from the American Heart Association, show that slow breathing at 6 breaths per minute for 15 minutes daily reduces blood pressure by 10 to 15 points within 8 to 10 weeks. One study found it was as effective as a single blood pressure medication. The mechanism: slow breathing maximizes heart rate variability, HRV, improves baroreflex sensitivity, your body's blood pressure regulation system, and increases nitric oxide production, which dilates blood vessels. There are apps and videos that provide visual or audio pacing to help you maintain the 6 breaths per minute rhythm. This technique requires consistency, daily practice over weeks, but the results are remarkable and lasting. Share alternate nostril breathing, Nadi Shodhana. The fourth technique is alternate nostril breathing, an ancient yogic practice called Nadi Shodhana that's now validated by modern research. This technique balances the nervous system and has powerful blood pressure lowering effects. How to do it: sit comfortably with your spine straight. Use your right thumb to close your right nostril. Inhale slowly and deeply through your left nostril for a count of 4. Close your left nostril with your right ring finger, both nostrils now closed. Hold for a count of 4. Release your right nostril and exhale slowly through your right nostril for a count of 4. Inhale through your right nostril for a count of 4. Close right nostril, hold for 4. Release left nostril and exhale through left nostril for 4. This is one complete cycle. Repeat for 5 to 10 minutes. When to use it: practice daily, ideally in the morning or before meditation. The science: research published in the Journal of Alternative and Complementary Medicine found that alternate nostril breathing practiced for 15 minutes daily reduced blood pressure by an average of 8 to 10 points within 4 weeks. This technique balances the sympathetic stress and parasympathetic relaxation nervous systems, reduces anxiety, and promotes cardiovascular harmony. Many people report feeling deeply calm and centered after this practice. 5. Resonance breathing. The fifth technique is resonance breathing, also called coherent breathing, breathing at your body's natural resonant frequency. For most people, this is 5 to 6 breaths per minute, which maximizes heart rate variability and cardiovascular efficiency. How to do it: sit or lie down comfortably. Breathe in for 5 seconds. Breathe out for 5 seconds. Continue this pattern for 10-20 minutes. Focus on smooth, effortless breathing. Let your belly expand on inhale and contract on exhale. Diaphragmatic breathing. When to use it: practice daily for at least 10 minutes, preferably 20 minutes. The science: studies show that resonance breathing practiced for 20 minutes daily reduces blood pressure by 10-20 points within 8 to 12 weeks. It's been studied in patients with heart failure, hypertension, and anxiety with remarkable results. This technique optimizes the relationship between breathing, heart rate, and blood pressure. It creates a state of physiological coherence where all systems work in harmony. Many people find this technique deeply relaxing and use it before sleep to improve sleep quality, which also helps lower blood pressure. These techniques are cumulative. The more consistently you practice, the better the results. Start with one technique and master it before adding others. Practice daily, ideally at the same times, to create a habit. Track your blood pressure, measure it regularly, and share results with your doctor. If your blood pressure improves significantly, your doctor may reduce medication dosage. Combine with lifestyle factors. These breathing techniques work best alongside healthy diet, regular exercise, adequate sleep, and stress management. Be patient. Some benefits are immediate, but lasting changes take weeks of consistent practice. Never stop blood pressure medication without medical supervision. Work with your doctor to adjust medications safely as your blood pressure improves. The 5 breathing techniques that can replace blood pressure pills: 4-7-8 breathing, box breathing, slow breathing at 6 breaths per minute, alternate nostril breathing, and resonance breathing. Each technique is free, safe, and scientifically proven to lower blood pressure significantly when practiced consistently. If this gave you natural tools to manage your blood pressure, please give it a thumbs up and share it with someone struggling with hypertension. Which technique will you try first? Let me know in the comments. Subscribe to Graceful Aging Guide for natural research-backed health solutions. Your breath is powerful medicine. Use it.